It's really important to get the pieces right. What our officers heard me say over and over and over again was each thing in its turn, each thing in its time. I said that over and over again. It would be executive meeting. Each thing in its turn, each thing in its time. And basically that message was, and the second thing is the old Zen saying, when the student is ready, the teacher appears. You heard that saying? Do you know what that actually meant? That actually, it sounds like somehow the universe will provide when you're ready as a student, the universe will provide a teacher. In the real Zen tradition, the Zen masters would identify a student that they thought would be a wonderful student, and they would sort of hover and be ready. And when the student was ready, the teacher would appear. It was actually a strategy from the teachers. It wasn't the universe somehow providing serendipitously a teacher. And I also taught that to our staff. I said, we have to get the student ready for each of these points. And then when the student is ready, the teacher needs to appear. And there would be points when I would say to the group, are you ready to appear on this point? Do we have the pieces we have? And so it was, again, a conscious, strategic process. But how do you get there? When you have no data, and you have inconsistent data, and when you don't have any kind of data sharing, you have to start by building data. And so one of the reasons that I said initially electronic medical record is going to be absolutely critical to what we do and foundational to what we do is because the medical record gave us the information set so that we could have uniform data everywhere. We couldn't have survived as a company, we couldn't have survived as a care system without that tool. We would have been eaten up by other competitors who were taking our patients and doing a number of things with us. Our brand was suffering, our credibility was suffering, and our functionality wasn't optimal. And we weren't winning, number one, HEDIS scores. We weren't winning service scores because we didn't have the toolkit we needed to do that. And the foundation for that toolkit was a medical record. So I knew that we needed an electronic medical record. We won the Robert Wood Johnson Pursuing Perfection Award the month that I left for Kaiser. It was because we had put the medical record in place, done some of the same kinds of things, and had done it in a continuous improvement mode.